Good afternoon, everyone. I'm Dr. Adam, and today we're going to talk in depth about a topic that affects millions of people: bad breath, or halitosis. More importantly, we're here to explore how to fix bad breath permanently. In today's talk, we'll examine the causes, look at the science behind oral bacteria and systemic influences, review the diagnostic process, and, most critically, discuss both proven and emerging treatments. By the end of our session, you'll have a complete roadmap for achieving long-term fresh breath and improved overall oral health. Before we begin, let me assure you that bad breath is often a symptom, sometimes a signal, of an underlying condition that needs attention. The goal isn't merely to mask odors with mints or sprays, but to tackle the root causes so that you can enjoy lasting, confident oral health. 1. Defining halitosis. Halitosis is the medical term for bad breath, and it can range from transient morning breath to chronic conditions that persist throughout the day. While many of us experience bad breath occasionally, chronic halitosis affects nearly 25 to 30% of the population, and its impact on social and professional life can be significant. 2. The microbiology behind it. The main culprits are bacteria, particularly anaerobic bacteria, that thrive in the oral cavity. These bacteria break down proteins in food particles and shed volatile sulfur compounds, VSCs, which produce the characteristic foul odor. Importantly, studies have shown that the back of the tongue is a major reservoir for these bacteria. That's why routine tongue cleaning is as vital as brushing your teeth. 3. Systemic influences. Bad breath isn't always just a local oral issue. Conditions such as sinus infections, gastrointestinal reflux disease, and even metabolic disorders can contribute. In these cases, the odor may be partially blood-borne. This is why a comprehensive evaluation is essential if basic hygiene adjustments don't resolve the issue. Common causes and misconceptions. 1. Inadequate oral hygiene. Poor oral hygiene is the leading cause of bad breath. Inadequate brushing, flossing, and tongue cleaning lead to plaque buildup. Over time, plaque calcifies into tartar, providing an even better habitat for odor-producing bacteria. Regular dental cleaning is critical to remove these deposits. 2. Gum disease and dental decay. Periodontal disease, or gum disease, often goes hand in hand with bad breath. Inflammation of the gums creates deep periodontal pockets where bacteria flourish. Not only do these bacteria cause odor, but they also contribute to systemic inflammation. 3. Dry mouth. Saliva is the natural cleanser of the mouth. When saliva production decreases, due to medications, dehydration, or systemic conditions, the mouth becomes a breeding ground for bacteria. 4. Dietary factors and lifestyle habits. Foods such as garlic, onions, and even certain spices can temporarily affect your breath. Smoking and excessive alcohol consumption not only dry out the mouth but also introduce chemicals that alter the microbial balance. 5. Myths and temporary fixes. Many believe that using mouthwash or chewing gum is a permanent solution. In reality, these are temporary masks that do not address the underlying causes. A truly permanent fix must target the root problem, whether that's bacterial overgrowth, gum disease, or another systemic issue. 1. Clinical evaluation. When a patient presents with chronic halitosis, the first step is a thorough clinical evaluation. This involves a detailed medical and dental history. We ask about symptoms such as dry mouth, gum bleeding, or dental decay. Sometimes, halitosis may be the first sign of a more serious systemic problem. 2. Oral examination techniques. We perform a comprehensive oral exam that includes visual inspection of the tongue for coatings or discoloration, examination of the gums for signs of inflammation or periodontal pockets, assessing the teeth for decay or areas of plaque accumulation. In some cases, we use a breath analyzer, a device that measures the levels of volatile sulfur compounds, to quantify the odor. 3. Laboratory tests and systemic workup. If we suspect that the problem is not solely oral in origin, we may order additional tests such as salivary flow rate measurements, blood tests to assess for conditions like diabetes or kidney dysfunction, Gastrointestinal evaluations if reflux or other digestive issues are suspected. Treatment options for a permanent fix. Enhancing oral hygiene. A rigorous oral hygiene routine is essential. Brushing. Brush at least twice a day with fluoride toothpaste. Use a soft bristled toothbrush and ensure that you reach all surfaces. Flossing. Daily flossing removes interdental plaque. Tongue cleaning. Use a tongue scraper or a toothbrush with a built-in tongue cleaner. This step is often overlooked but is crucial for reducing the bacterial load. Professional dental cleaning and periodontal therapy. For patients with significant plaque or periodontal disease, professional dental cleaning is indispensable. Scaling and root planing help remove tartar and reduce deep bacterial reservoirs. In advanced cases, periodontal surgery may be required to eliminate deep pockets that harbor bacteria. Addressing dry mouth to manage xerostomia. Hydration. Encourage patients to drink water throughout the day. Saliva stimulants. Chewing sugar-free gum or using lozenges can help stimulate saliva production. Medications. In some cases, doctors may prescribe medications to increase salivary flow. Lifestyle adjustments. Avoid alcohol and caffeine, which can exacerbate dry mouth. 4. Treating underlying systemic conditions. If the bad breath is linked to a systemic issue, gastroesophageal reflux disease, GERD, treat with dietary changes and medications such as proton pump inhibitors. Diabetes. Tight glycemic control is essential, as uncontrolled diabetes can exacerbate gum disease. Sinus or respiratory infections. Appropriate antibiotic or anti-inflammatory treatments can help reduce the odor. 5. Novel and adjunctive treatments. In recent years, several adjunctive therapies have shown promise. Zinc-containing toothpastes and mouthwashes. Zinc ions bind to volatile sulfur compounds, neutralizing them. Probiotics. Emerging research suggests that certain probiotics may help rebalance the oral microbiome by outcompeting odor-producing bacteria. Laser therapy. For severe periodontal disease, laser treatments may reduce bacterial load and promote tissue healing. Nasal breathing techniques. Encouraging nasal breathing, sometimes aided by methods such as mouth taping, can help maintain moisture and balance in the oral cavity, though this is only suitable for some individuals. 6. Behavioral and lifestyle modifications. Long-term success in curing halitosis often requires changes in daily habits. Diet. A balanced diet rich in fruits and vegetables can improve saliva quality and overall oral health. Avoid excessive intake of odorous foods. Smoking cessation. Quitting smoking not only improves breath but also enhances overall health. Regular dental visits. Scheduling checkups at least twice a year ensures early detection and treatment of any dental issues. Stress management. Since stress can reduce saliva production, techniques such as meditation and exercise can indirectly help maintain fresher breath. Prevention and maintenance. 1. Establishing a daily routine. Permanent resolution of bad breath is not achieved overnight. It requires a daily, disciplined routine. This includes brushing, flossing, and tongue scraping every morning and night. Using an antibacterial mouthwash that is alcohol-free to avoid drying out your mouth. Keeping hydrated throughout the day to promote natural saliva production. 2. Follow-up and monitoring. After initiating these interventions, regular follow-up appointments with your dentist are critical. These visits help monitor progress, adjust treatments as necessary, and ensure that any underlying conditions are controlled. 3. Educational component. Educate yourself and your family about the importance of oral health. Understanding how lifestyle, diet, and systemic conditions affect breath can empower you to make changes that lead to lasting results. Permanently fixing bad breath is achievable when you address the root causes rather than merely masking the symptoms. By combining a meticulous oral hygiene routine, professional dental care, targeted treatments for conditions like dry mouth and gum disease, and healthy lifestyle modifications, you can restore fresh breath and improve your overall quality of life. Remember, bad breath is often a sign that something in your body needs attention. A comprehensive approach, not just a quick fix, will yield the best results. I encourage you all to be proactive in your dental care and consult with your healthcare provider if you notice persistent issues. Thank you for watching. Don't forget to subscribe for more expert